So this talk is about software, but I realize software in and of itself isn't that exciting. What I hope you will find exciting is that we are developing a tool that you can download today, which will enable you to explore an entirely new functional lung imaging modality called CT ventilation imaging. So why are we interested in CT ventilation imaging in the radiotherapy space? Well, the main clinical driver for this work is that it depends on the treatment modality, of course, but radiation pneumonitis is still a major dose-limiting factor for lung cancer radiotherapy. It's symptomatic in up to 30% of patients and remains fatal in up to 2%. It's a really exciting time for functional lung imaging in lung cancer radiotherapy, because increasingly we're starting to see new trials looking at the use of functional imaging to avoid irradiation of functional zones in the lung, with the aim to spare functional lung regions and thus improve toxicity outcomes. So it's anticipated that this could improve the functional dose volume metrics by 5 gray or more, which translates to a few percent of patients that may avoid severe toxicity outcomes as a result of lung cancer radiotherapy treatment. So it's a very important goal. It's something we're all really excited about. So what's the challenge to make this happen? Unfortunately, the gold standard ventilation imaging techniques such as Technogas SPECT and Galagas PET, and I should mention that these are images from New South Wales and Victorian centres. So this is technology we use here in Australia. It's still only available for a few percent of lung cancer radiotherapy patients, mainly as part of clinical trials. Hence, CT ventilation imaging. What is this technology? Actually, there is another speaker who will be talking about 4-dimensional CT or respiratory correlated CT. This is a technology that allows us to see not only the spatial distribution of anatomy in the lung, so X, Y, and Z, your Cartesian coordinates, but also how the lung tissue elements move in time. So it's 4-dimensional. So CT ventilation imaging visualizes air volume changes in the lung, or ventilation, a surrogate for physiological function, by quantifying this breathing-induced respiratory motion using an image processing technology called deformable image registration, or DIR. So it works in 3 steps. From our 4D CT, we quantify the motion of every lung tissue element in the image, like so, and quantify the amount of regional contraction or expansion, as well as density changes due to breathing, which are both surrogates for function. What are the advantages of this CTVI, or CT ventilation imaging technology, compared to clinical gold standard technologies like SPECT and PET? Some of the advantages are that if you're a lung cancer radiotherapy patient, it's estimated that up to 70% of patients now will receive one of these 4D CT scans. So at no extra cost in scan time or imaging dose, we can extract this functional information and potentially understand the dose volume effects in the lung, and potentially, if we can show good enough correlations between functional dose volume parameters and clinical outcomes, actually use this kind of technology to modify and improve the treatment plans that we're delivering to these patients. The challenge for the clinic, at the clinic level, is that there are no freeware tools out there to do this. You have to develop the workflow yourself. And I speak from experience when I say this can take a few years to get all these components talking to each other. You're talking about importing images from DICOM to other imaging formats, performing lung segmentation, deformable image registration, getting regional Jacobian determinant image matrices. If that all sounds like too much effort, then this tool is for you. And we hope you find it useful. VESPIR, it's not a great acronym. Ventilation via Scripted Pulmonary Image Registration. It's currently designed for the MATLAB programming interface. I felt really bad about including a screen capture from MATLAB. I'm glad that I'm not alone by taking screen captures from software. What I want to point out is in this, I don't know if that's, okay. Here are our 10 respiratory correlated phase bins of the CT scan. That's all you need to do to use this software. Once you have your data sorted in that format, if you look at the lines on the right-hand side, these are actual commands I'm feeding into MATLAB to obtain these images. In 8 lines, we can import those files, can segment the lung, determine which of those respiratory phases was the peak exhale or inhale phase, perform the deformable registration from one to the other, and then quantify the regional contraction or expansion of the lung, which is our surrogate for function. And finally, which is the important part, export that back to DICOM so you could import that into your treatment planning system. Now, of course, a software like this is for research purposes only, but having this technology available allows you to see for yourself in your own clinic how well these CT ventilation images might agree with other kinds of ventilation imaging modalities you have available, and also determine how having that kind of information might have influenced the choices you made for these patients. Quality assurance, a really important part of radiotherapy. It's also a very important part of CT ventilation imaging. An advantage of this software is that you can export exactly the sorts of images you need to understand whether your deformable image registration is actually working. In this case, we see a before shot, so it's an image fusion of the exhale and inhale phases of the 4D CT. You can see green and magenta in this image, which means the image features did not align. After the deformable registration, they match up much better. There are many ways to quantify the accuracy of deformable image registration, but this is possibly the most visual and the most intuitive. Did our technology correctly register these anatomic features as resulting from the motion? We can also export different kinds of ventilation images, which is really interesting. We can look at how different quantification methods, for example, looking at regional volume changes or regional density changes, tell us different pieces, possibly complementary pieces of information about how patients are actually breathing. For those that are really interested in looking under the hood at this kind of technology, you have the power to influence many parameters in this process. You can look at pre-filtering of the images, the use of a lung mask or not as part of your deformable image registration algorithm, the kind of image similarity metrics, and so on. I won't bore you with all the parameters, but it's important to note that all of them can have an impact on the result. And so the real power of this tool is to understand the impact of these computational parameters and what is the most effective and accurate form of CT ventilation imaging in your own clinical setting. So I guess one of the most satisfying parts of my work is that I get to interface with a few clinical groups in New South Wales and elsewhere in Australia, getting to look at 4D CT scans of patients and comparing them against other ventilation imaging modalities like SPECT and PET, often acquired on the same scanner. It's really exciting to be looking into a new technology like this and trying to determine how accurate it actually is. This is one example of how a cross-modality validation study works. We take, in this example, from Peter MacCallum Cancer Care Centre in Melbourne, they're getting 4-dimensional PET CT scans using ventilational GalliGas PET on the same scanner, which is fantastic. We have the same patient, the same day, the same hardware used to receive both, to obtain both the 4D CT and the nuclear medicine components of these scans. You would expect it's the perfect modality to compare against 4D CT ventilation. We extract both these kinds of images. We obviously take the GalliGas PET, the nuclear medicine, as our ground truth, although, to be fair, nuclear medicine isn't perfect either. We perform some post-processing, and then we can compare these images directly. What do we see? So qualitatively, it's really interesting to look at. So on the left side here, I've got a CTVI, the VESPIR produced image, versus our nuclear medicine PET. For different patients with different ventilation defects, the CT ventilation may be more or less accurate. It's quite complex. At the moment, we're also trying to quantify that voxel-wise, so every pixel of one image modality plotted against every pixel of the other. And this plot isn't just for one image. This is against 25 patients, 3 time points. the beauty of MATLAB, or any software which you can script, is suddenly you have the power to explore accuracy over a vast amount of data. And we're seeing some really interesting positive correlations between these different modalities. So in this figure, you can see what looks like a clustering of points around a diagonal line. If it was a perfect correlation, it would be a straight line. Things are never quite perfect in the clinic, but we're seeing positive correlations, which is really exciting for this technology. I guess, you can zoom out rather than looking at the voxel level in terms of our accuracy measure. We can look at the lobar level or different levels of accuracy. And this was a really innovative study that was done at the Royal North Shore Hospital, thanks to my colleague, Dr. Enid Eslick. And she compared the CT and PET ventilation images after segmenting lobes. So a bit of manual work there to do that. But she was seeing absolutely stellar correlations. So somewhere between the voxel level and the lobar level is where this technology really can tell us something very useful about lung function for radiotherapy patients. So what is the future for this technology? At the moment, the main goal of CT ventilation imaging research is really validation. So we're performing cross-modality comparisons across all sorts of different technologies. And if you see a gap in this table, or if you would like to get involved in these kinds of correlation studies, please come and talk to us, because we're very happy to hear experiences with this technology. I was going to have a conclusion slide, but I realized that really the conclusion for this technology is up to the clinicians, it's up to yourselves. You can explore CT ventilation imaging yourself today. Please send me an email, and I will provide you a way to obtain this technology. All you need is a laptop. I've said Windows here, but that's not really necessary. If you're willing to compile code, and perhaps a few of you are, you can do this on your Mac or your Linux machine, and before long, you won't need MATLAB either. We hope you find this technology really interesting, and once again, I would like to thank all the researchers who've helped me produce this piece of code, and also the Cancer Institute of New South Wales for making this happen. Thank you.
I'm wondering if there's anyone else in the world that might be looking at the way that they're analysing the data that you are.
Actually, there are quite a few groups, both in the US and Japan and Europe now, correlating CT ventilation-based functional dose volume parameters against other imaging modalities, but also clinical measures of function, so spirometry-based FEV1 or FVC, also looking at clinically graded toxicity outcomes. However, what's lacking is a tool that anyone can use. If you don't have Pinnacle, or if you're not adept at using the commercial deformable registration software, where do you begin? And so that's what I hope this tool is able to provide.
Thank you. Any other questions? No? All right, well then, sorry. Thank you very much
Cool, thank you.
for your presentation.